Hi, welcome to Tina's Farm TV. This is my first video blog, and today I'm going to discuss mercury. It is well known that mercury is a highly toxic and unstable compound, yet somehow we are led to believe that it is safe once it's put inside your mouth. Now this really doesn't make sense, that it's toxic and unstable in any other environment and even needs to be transported in hazardous material or hazardous waste. It has to be disposed of appropriately. Dentist's office have to dispose of it a certain way because it's hazardous material, yet it's supposed to be safe when we put it in our mouth, and that just doesn't make sense. Mercury vapors are given off from simple things such as brushing your teeth or eating. So if you have mercury fillings, they're constantly letting out vapor, and this can lead to health consequences. Now, mercury fillings are also called silver amalgams, and they're called this because there is silver and other elements in them, but they're more than 50% mercury. And the name silver amalgam is kind of misleading, so that people are led to believe, again, that it's safe, because people know that mercury is not a safe substance. Mercury is a dangerous toxin because it can affect your brain, central nervous system, and your kidneys. It's especially dangerous to young children and pregnant women since the brains of young children are still developing. If fetuses are exposed to mercury while they're developing, they can have language deficits after they're born, attention disorders, and it may even be linked to autism. Mercury also may be linked to heart disease and certain autoimmune diseases such as multiple sclerosis. Not only is mercury not that good for your health, but my dentist also explained to me that it's not good for your teeth because mercury is such an unstable substance, so it contracts and expands. When you eat or drink hot or cold substances, this causes the mercury to contract and expand, which breaks your teeth. If you decide that removing your mercury fillings is the right thing for you, you need to make sure that you do it in a safe way. Not every dentist is trained on the appropriate removal of this toxic substance. You want to find a dentist who is a biological dentist or a holistic dentist. Dentists who are certified or have trained with the International Academy of Oral Medicine and Toxicology are also a great resource, and that's how I found my dentist. The procedure involves a rubber dam that's placed in your mouth. As you can see in the video, it stretches across your mouth so that you are less likely to inhale any toxic mercury vapors. You also want to have a dentist who uses a vacuum that is put very close to your mouth to suck up all of the mercury vapors so you don't have the chance to breathe them in. Sections that are close to each other, that are next to each other, are all removed at once, and it's recommended that you do not be in the chair for more than 2 hours. So if you have a lot of mercury in your mouth, you may need more than one session, and it's recommended that you wait 1 month in between sessions so that you're not exposed to too much toxic mercury all at one time, because this can overload your immune system. In order to help make my body healthy before I had the mercury removed, I took some supplements to help support my liver. I took N-acetylcysteine and milk thistle. I continued to take my probiotics. I continued to take fish oil. Cilantro and parsley, garlic, onions are all great mercury detoxifiers, so I made sure I loaded up on those after the procedure as well as before to help get healthy. Chlorella, spirulina, nettle, dandelion, these are all things that also help with mercury detoxification. Vitamin C is extremely important. If you want to take it after the procedure, if you take it before, it can interfere with anesthetic, and you don't want that because you want to be numb so you don't feel the procedure. I loaded up on vitamin C for 3 days after, and then I kind of backed down on the dose after that. The main side effect of vitamin C is diarrhea, and it is recommended that you load up enough so that you experience the diarrhea to help get the mercury out of your system, and then you back down on the dose and do 2/3 of the dose that gave you the diarrhea, and that's your optimal dose for the 3 days after. A high protein diet is also helpful in helping your body detox from the mercury. I used coffee enemas, which I'll discuss later when I discuss the Gerson therapy. It is recommended that you drink a drink of activated charcoal, which is basically just this gray, gritty stuff, but it doesn't have much taste. It's not the most pleasant thing to drink, but at least it doesn't taste bad. You drink it right before, so that way if any particles get in, they'll be bound right away. And then you drink it right after the procedure as well to make sure you didn't miss anything that may have been absorbed. And this will ensure that it binds up to the charcoal and goes out of your system instead of going into your bloodstream. Remember, if you decide to get the mercury taken out of your mouth, to do it safely. Thanks for watching Tina's Pharm TV. Check me out at tinasfarm.com and see you next time.